Welcome back, everybody. It's 6:30 on a Wednesday morning. I was at the Baby Boom Expo in April, and I met Dr. Joey Stenson and talked to him at length about what he does. He's the first vascular surgeon in Northeast Mississippi. He's one of only a handful of true vascular surgeons in the entire state. We should probably talk about what is a vascular surgeon and why it's important to start thinking about the blood flow. Basically, it's blood flow, arteries and veins in and out of the heart.
Yeah, well, so vascular surgeons are surgeons that are particularly trained, did extra training for peripheral arterial disease and arterial disease in general and venous disease. It's an extra 2 years of training after general surgery, and the reason it's so important in the state of Mississippi is because Mississippi has such a high rate of vascular disease and diabetes.
One of the highest in the country.
One of the highest in the country. The diabetes
and amputees.
Amputations are one of the highest rates in the entire country. That's related to overall health of the state and risk factors such as smoking, diabetes, high blood pressure, high cholesterol. All those are factors that contribute to arterial disease and ultimately amputation rates.
When we were talking in April, you specifically, do you have trouble walking? Is there a pain in your leg, and is it recurring and especially noticeable when you're walking? And I found that fascinating because a lot of us have pain, and there's ways to screen for it, to find out what's going on.
Yeah, one of your first symptoms of arterial disease is pain, such as the calf. When you walk a certain distance, 50 feet, 100 feet, you start having the reproducible cramping pain in your calf every single time, and it goes away once you stop walking. That's the earliest signs of vascular disease. Now that's called intermittent claudication. That is not limb-threatening in it of itself. It's a risk. It's a factor to show you other arterial problems throughout the rest of your body. That can be treated, if caught earlier, first with risk factor modification, smoking cessation being a primary.
You mentioned smoking. We talked about it at length, and at one point in my life, I'm ashamed to admit this, but I smoked for about 8 years, and you can recover from that, but you've got to quit smoking.
You have to quit smoking. If you progress to critical limb ischemia, which is pain all the time in your legs, or wounds on your feet, that's higher chance of amputation. If you continue to smoke, you can have up to the 80% chance of an amputation, and if you have that and you continue to smoke. Also, smoking, once we intervene with bypass surgery to restore blood flow to your legs, your chance of that failing drastically are increased if you continue to smoke. So that's why smoking cessation is primary treatment modality before we do anything further.
We all know about the risk of cancer in smoking, but this was a brand new one for me. I had never heard of this. And you explained, and we're running out of time, so I'm going to ask you to come back and talk a little bit about what are the procedures? How do you fix this problem? And there are several different ways. Just briefly explain.
So again, vascular surgery has a full gamut of treatment options. So we do minimally invasive stents, angioplasty, or balloons, atherectomy, and then of course surgical bypasses, which is the tried and true method of restoring blood flow to your extremities. And vascular surgeons can do all of the above.
When you come back, I'm sorry, we're about out of time, but when you come back, let's talk about why it's important to have a specialist like yourself perform these kinds of treatment options. All right? Dr. Joey Stenson, thanks so much. Came all the way down from Tupelo, Mississippi to be here this morning. Let's see what we can do and get you back on, okay?
Okay, thank you.
Thanks so much. All right, let's go to Alex now for a look at our weather.